Med history.
Acanthoceratoderma, blue skin syndrome. The scientific name of this extremely rare and strange disease is difficult to pronounce the first time. Acanthoceratoderma. A person with such a diagnosis turns into a smurf, that is, has blue or plum-colored skin. Experts believe that such a disease is transmitted only by inheritance. So in the last century, a whole family of blue people settled in the American state of Kentucky. They even came up with a special name for them, the Blue Fugates. By the way, apart from appearance, nothing else indicated any other physical or mental abnormalities in people with this disease. And a good half of the family has generally lived for more than 8 decades. Black acanthosis, pigmented papillary dystrophy of the skin, was first described in 1889 by the German dermatologist P. Una and his American colleague S. Politzer. It is mainly found in blacks, 13.3%, and Latinos, 5.5%. Among representatives of the European race, the frequency does not exceed 1%. The disease is more often registered in women. It is considered a sensitive marker of insulin resistance among overweight people. Malignant black acanthosis occurs in people with cancer, 12,000, mostly older than 40, 50 years. Reasons: black acanthosis most often develops a second time against the background of hormonal disorders, tumor processes, and toxic influences. In some cases, there is no connection with other factors. Such a condition is regarded as an idiopathic form. The causes of the condition are grouped into several groups. Endocrinopathy. The most common cause of black acanthosis is hyperinsulinemia and associated pathologies, metabolic syndrome, obesity, type 2 diabetes. Insulin resistance is also often accompanied by PCOS, acromegaly, Ytsenko-Cushing syndrome, hypothyroidism, a side effect of pharmacotherapy. Skin dystrophy can occur when taking elevated doses of nicotinic acid, COCs, steroid hormones, and growth hormone. Malignant neoplasms. In most cases, malignant acanthosis is etiologically associated with adenocarcinoma of the stomach, rectum, pancreas, ovaries, lungs. It appears less often with lymphoma, osteogenic sarcoma, and breast cancer. It is considered as paraneoplastic dermatosis. Hereditary diseases. Black acanthosis can occur in the structure of ectodermal hydrotic dysplasia, Clauston syndrome, which is also characterized by hypertrichosis, nail dystrophy, hyperkeratosis. Another related pathology is Mischer syndrome, DM, imbecility. Black acanthosis in most cases serves as a marker of diseases of the endocrine glands. This condition is considered a high-risk factor for insulin-dependent diabetes mellitus. It may indicate the presence of dysfunction of the ovaries, adrenal glands, and thyroid gland. The malignant variant is an indicator of the development of the neoplastic process and as a rule is associated with its unfavorable course, aggressive growth of the neoplasm, metastasis, multiple tumor lesions. Classification of the disease. According to the etiology, there are 5 types of black acanthosis. Type 1 is hereditary benign acanthosis nigricans, which develops in the absence of pathology of the endocrine system and manifests itself in childhood or during puberty. Type 2 is benign acanthosis nigricans, which develops in endocrine diseases accompanied by insulin resistance. Type 3, false acanthosis nigricans, which develops with obesity on the background of insulin resistance, is more common in patients with dark skin. Type 4 is medicinal acanthosis nigricans, which develops during treatment with nicotinic acid in large doses, glucocorticosteroids, somatotropin. Type 5 is malignant acanthosis nigricans, which develops with adenocarcinoma of the gastrointestinal tract, urinary tract, and genital organs, less often with lymphomas. Treatment of black acanthosis. Therapy of the underlying disease. Correction of background disorders is a necessary condition for combating skin manifestations. Taking into account the cause of black acanthosis, the following tactics can be used. Cancellation of medications. If the association of black acanthosis with an overdose of drugs is found, the dose is adjusted or replaced with other drugs. Correction of endocrine disorders. In order to normalize weight and eliminate hyperinsulinemia, a low-calorie diet and biguanide intake are prescribed. With hypothyroidism, levothyroxine may be required. The methods of choice for PCOS are hormone therapy, cauterization, and wedge-shaped ovarian resection, anti-tumor treatment. In the malignant form of black acanthosis, removal of the tumor formation is indicated. Depending on the localization of the process, gastrectomy, hemicolectomy, nephrectomy, pneumonectomy, mastectomy, and other types of radical operations can be performed. Surgical treatment is combined with radiation therapy and chemotherapy courses. Black acanthosis is a pathological change in the skin in which it becomes black or dark. This condition is usually associated with hyperpigmentation, that is, an excessive amount of pigment in the skin. Black acanthosis can be caused by various causes, such as inflammation, infections, diseases of internal organs, or metabolic disorders. Treatment of black acanthosis depends on its cause and may include the use of topical medications, physiotherapy, or treatment of the underlying disease.